This video will demonstrate IV push via peripheral saline lock, INT. Verify MAR and healthcare providers' orders for medication.
I'm checking the physician's orders in the MAR for Diane Curtin. The medication ordered is Solumedrol 200 milligrams IV push.
Review allergies.
The MAR says allergies are NKA, which is no known allergies.
Research pertinent information about the medication. Class and action, dosage range, desired or therapeutic effects, adverse effects, nursing implications, pre-administration assessment such as last PRN dose, lab values, vital signs, length of administration time, and dilution requirements.
You can check yesterday's medication record for the PRN dose and also the lab report over on the left side of the screen.
Gather necessary equipment and supplies.
Your syringes are located in the drawer at the side of the room. And since I haven't done the calculation yet, I'm going to grab a 5 ml and a 3 ml syringe. I'm also gathering blunt tip needles and clean gloves. Alcohol swabs are on my WOW and also swab caps. I have calculator and pencil available for my calculation.
Introduce self, name and credentials.
Hi, I'm Mary Jo, the RN going to be taking care of you today.
Hi. Perform hand hygiene and provide privacy.
I would pull my curtain.
Identify client times 2 identifiers and compare to MAR. Scan patient armband and verify allergies with patient.
Can you state your name for me?
Diane Curtin.
Okay. And what is your birthday?
June 14th, 1941.
And do you have any allergies?
No, I do not.
All the information matches, and then I will scan her ID badge.
Select and scan correct medication vial and normal saline flush syringes. Verbally verify the 5 rights of medication administration on vial and syringes. First check.
To access my medication, I put in the code 1234 and the drawer will pop open. I gather my medication and also 2 saline flush syringes. I'll begin my first check by scanning my medication and scanning my saline flushes. First check of the 5 rights. I have Diane Curtin. Medication ordered is Solumedrol, and in my hand I have Solumedrol. The amount is 200 milligrams. In my vial, I have 125 milligrams per ml. I'll need to be doing a calculation. The route is IV push. I'll administer this IV push. Frequency is daily, and the time due is 0900, and it is currently 0900. My first check for my saline flushes, which are located in the PRN section of my MAR. For Diane Curtin, I have drug ordered 0.9 sodium chloride, and I have 0.9 sodium chloride and 0.9 sodium chloride. The amount is 2.5 mLs, and in my syringes I have a little more than 2.5 mLs with an air bubble, so I'll be doing an adjustment there. The route is IV push. I'll be administering these IV push. Frequency is as needed per flush protocol, and the time ordered is now, and so I'll be giving it now.
Calculate correct order dosage and correct infusion rate per agency policy, the pharmacist, or medication reference manual. The example uses the formula method and demonstrates how to calculate the number of milliliters needed, and then explains the amount of med to give in each 30-second interval. The dose to be given is 1.6 milliliters, and Mary Jo will administer 0.4 milliliters every 30 seconds. Prepare medication maintaining aseptic technique.
I'll be cleansing the top of the vial 15 to 30 seconds depending on hospital protocol and letting that dry. Since the amount of fluid that I need is 1.6 mLs, I'll be using the 3 ml syringe. I've checked out the increments on the syringe and each line is worth 0.1 ml. I'm going to build my syringe, being careful to not contaminate either connection, and making sure that's screwed on tightly. I'll draw back 1.6 mLs of air, and you can move this around a little bit so that it doesn't stick for you with the new syringe. I'll inject the 1.6 mLs of air into my vial and then draw back more medication than what I need. Get the air to the top of the syringe and inject it to my 1.6 mLs so that I'm right on the line with no air bubbles. Scoop to recap.
Label medication syringe with name, med, concentration of vial, and syringe.
I'm going to put the patient's name, the name of the drug, the dose, and the concentration. Apply the label where the fluid is not in the syringe so that I'm not over the increments. Now I'm going to adjust the amount in my saline flushes. On these, I need to break the seal. I'm going to pull back on the syringe plunger. Get the air to the top and then adjust it to the 2.5 mLs. Got the air bubble to the top. I'm going to adjust the fluid to the 2.5 and rid the air bubble. Now I'm going to do my second check. This is for Diane Curtin. The drug ordered is Solumedrol. In my vial, I have Solumedrol, and in my syringe, I have Solumedrol. The amount ordered is 200 milligrams. I have 125 milligrams per ml, and my calculation came out to 1.6 mLs. And in my syringe, I have 1.6 mLs without any air bubbles. The route is IV push. I'm going to administer this IV push. Frequency is daily, and the time due is 0900, and it is currently 0900. I can put this vial back in my drawer. My second check on my salines. This is for Diane Curtin, and the drug ordered is 0.9 sodium chloride. I have 0.9 sodium chloride and 0.9 sodium chloride. The amount ordered is 2.5 mLs. I have 2.5 mLs without any air and 2.5 mLs without any air bubbles. The route is IV push. I'm going to administer these IV push. Frequency as needed for flush per protocol, and the time is now.
Verbally verify the 5 rights of medication administration on the IV push med in the normal saline flushes. Third check.
Third check of my 5 rights. This is for Diane Curtin. The drug ordered is Solumedrol. On my label, I have written Solumedrol. The amount is 200 milligrams, which I have calculated to be 1.6 mLs. On my label, I have 200 milligrams equals 1.6 mLs, and I have 1.6 mLs without any air bubbles. The route is IV push. I'm going to administer this through her IV. Frequency is daily, due at 0900, and it is 0900. Third check on my saline flushes. This is for Diane Curtin. The drug is 0.9 sodium chloride. I have 0.9 sodium chloride and 0.9 sodium chloride. The amount is 2.5 mLs, and in my syringe I have 2.5 mLs and 2.5 mLs. The route is IV push. I'm going to administer these IV push. Frequency is as needed per protocol, and the time is now, and I will be administering it now at 0900.
Discuss the purpose of each medication, its action, and possible adverse effects. Explain that you will give the medication through the patient's existing IV line. Allow the patient to ask questions. Encourage the patient to report any symptoms of discomfort at the IV site.
Ms. Curtin, I'm going to be administering your Solumedrol through your IV site. I won't have to be poking you again, but let me know if you have any discomfort or any questions.
Okay, thank you. Apply clean gloves. Assess IV site for any signs of phlebitis or infiltration. Remove gloves. Perform hand hygiene.
I'm looking at the site for any redness, warmth, or tenderness that would indicate phlebitis. If something was infusing previously, I might have signs of infiltration, which would be swelling or coolness or any discomfort. Remove my gloves, glove to glove, skin to skin, and wash my hands.
Cleanse INT port per agency policy, or remove swab cap.
If there was a swab cap, I would remove that, but on this one there currently isn't, so I'm going to cleanse for 15 to 30 seconds and get the grooves on the side and the tip.
Break seal on first normal saline flush syringe and purge air from syringe.
This can be done previously as I did with my checks, or you can do it now, but it definitely needs to be done before you connect this to your IV.
Attach normal saline flush syringe into INT port. Release clamp if present. Pull back gently on plunger of syringe and check for blood return. Slowly flush the INT with the normal saline, observing the site for infiltration and ease of flushing. Remove syringe.
I'm going to pull back on my saline, and I'm noting here if there's a blood return. Once I see that flashback of blood, I'm going to slowly push that saline, the 2.5 mLs, and I'm noting the ease of flushing. Am I meeting any resistance? And I'm also looking at the insertion site to see that there's no infiltration.
Cleanse INT port per agency policy.
Again, I'm cleansing the side and the top for 15 to 30 seconds.
Attach medication syringe into INT port. Inject the medication in the time calculated. Observe site for infiltration. Remove syringe.
At this point, I've already assessed the site, so I know I have a good IV site, so I can begin pushing my medication slowly. I'm going to count 0.1, 0.2, 0.3, 0.4, and now wait 30 seconds. As I'm waiting the 30 seconds, I'm noting my patient's condition, assessing the site, making sure she's not experiencing any discomfort or any type of side effect. After 30 seconds has passed, I'm going to again push 0.4, 0.1, 0.2, 0.3, 0.4. Again, I would wait 30 seconds, but for time purposes, we'll just pretend that the 30 seconds has passed. After that 30 seconds, I push the next 0.4. 1, 2, 3, 4. Wait 30 more seconds. Once 30 seconds has passed, I push the final 0.4. The whole time I'm assessing my patient.
Break seal on second normal saline flush and purge air from syringe. Cleanse INT port per agency policy.
Again, if I did not prepare my saline as I did with my checks with the 5 rights, I would be expelling that air and adjusting the amount of saline in the syringe at this point.
Attach normal saline flush syringe into INT port. Inject flush at same rate as medication administration for 1 ml. Slowly push remaining flush. Observe site for infiltration. Reclamp INT per agency policy and remove syringe.
On my saline flush, the increments are every 0.5. So I'm going to push just above the 2 ml, which would be approximately 0.4 mLs, and wait my 30 seconds. After 30 seconds goes by, again, I'm going to push 0.4. Wait 30 seconds. Push another 0.4. Wait 30 seconds. And push my final 0.4 until I have 1 ml left. And now the second ml I'm going to push slowly, noting that the patient's not having any reaction or problems.
Apply new swab cap to port. Stay with patient for several minutes and observe for any adverse reactions. Dispose of used supplies per agency policy. Reposition patient for comfort, call light within reach, leave patient in safe environment, and perform hand hygiene.
Here's your call light, Miss Curtin.
Thank you.
Are you feeling okay?
I'm fine.
Are you comfortable?
I am.
Okay.
Document IV push and normal saline flush administration on MAR, 6th right, scan badge.
I'm documenting 2 of the saline on my 0.9 sodium chloride 2.5 ml IV push, since I did use 2 of those syringes. I put the time and my initials and strike through both.
At the end of the procedure, the instructor will note that the student maintained proper body mechanics, maintained patient safety, and maintained sterility during and throughout the procedure.